My name is Evita James. Healthcare delivery is changing quickly, and this is because of artificial intelligence and a growing aging population. Healthcare organizations will need confident leaders at every level who have knowledge, skills, and abilities to guide their team through change. Leaders will be especially important because they can motivate their teams to take ownership of tasks and goals at the grassroots level. And this is where it matters the most. Leaders are not simply born this way. However, they can develop these skills by becoming goal oriented, by building self confidence, and strengthening their internal motivation to learn at every turn. Healthcare leadership depends on a strong electronical human resource management, which begins with recruitment of a talented and skilled workforce, which is technologically savvy. Therefore, HR leadership must be equally prepared with cutting edge technology. This is important because a skilled workforce is key to organizational success, which begins with recruitment. The emerging trends qualify cutting edge organizations as those that make investments in human resource technology that allows the workforce to thrive. For example, these trends include specific platforms that allow for the recruitment and talent acquisition that can streamline the recruitment process by automating job posting, applicant tracking, and resume screening. Other platforms also allow employees onboarding, which can facilitate their digital orientation materials, training modules, and company policies for new and uh, already established workforce. Although emerging human resource technology has shown benefits, it may lack inclusivity from time to time. For example, a skilled worker who is not technologically savvy but is otherwise qualified may not have access to technology or may not have strong technological skills. To support diverse, equitable, and inclusive workforce, electronic health human resource platforms should include onboarding opportunities that help bridge the gap between workers who already have technological skills and qualified workers who need support building those skills. The increasing aging population will accentuate healthcare shortage moving towards 2030 when the youngest baby boomer will turn 66 years old. Many state governments have already prepared by unlocking nurse practitioners and physician assistants into independent practice, which do not necessitate the co-signing of a medical doctor. Will this be enough? Do international medical doctors need credentials to provide telemedicine to patients in the US? How can these physicians be unlocked to provide telemedicine or even in person medical care without meeting the rigors of medical training of US physicians? While these questions are being sorted out, the World Health Organization has developed a code of conduct with the aim to protect poor countries from a deteriorating medical care resulting from the demand for skilled workforce in richer countries. The Code of Conduct provides an important ethical framework to ensure that international migration of health professionals is organized responsibly for both countries of origin and the destination country. In 2030, the goals of the Triple Aim will continue to have a seat at the table. Innovations will cater to patient centered demand, fueled by AI. Higher education and medical schools specifically will incorporate the use of AI more broadly while finding innovative ways for the learning process goals to be reached. Now, back to those questions I posed earlier. Items that are thought of as challenges today will likely be easily engineered by the use of AI. For example, building capacity for access to affordable care could be increased by aligning international physicians willing to perform telemedicine for US patients. The evaluation and intervention prescribed by the international physician will be analyzed with the use of AI and by parameters that lend validity to the intervention, whether it is pharmaceutical or surgical. This system of care could decrease wait times for new visits, and will decrease wait time for workup of symptoms by reaching a diagnosis sooner and hence a treatment plan. In this system, medical doctors, even primary care physicians, could become consultants, and mid level and international physicians will be referring providers. By providing telemedicine, the international physician gains a better understanding of the U.S. medical system. Ethically, it allows for the international physician to continue their work within their local community and is consistent with the code of ethics as prescribed by the World Health Organization. Thank you for your time, and I will see you in 2030.